Good morning students. Today's class we see the September 2017 question paper. Define and discuss etiology of PPH. Explain the management women with PPH, which I already referred in September 2015 video. Define first stage of labor. Explain the physiological changes of the midwife and the role of midwife during the first stage of labor. Definition: it is the beginning of the true labor pain till the full dilatation of cervix. The physiological changes include uterine factors and mechanical factors. The uterine factors are fundal dominance, polarity, contraction, retraction, formation of upper and lower uterine segments, retraction rings, cervical effacement, cervical dilatation, and cervical ripening. Mechanical factors include general fluid pressure, fetal axis pressure, formation of fore water, rupture of membrane. The nursing manage the role of midwife during the first stage of labor include we have to get the history of the current pregnancy, onset of labor, frequency, duration and intensity of contractions, membrane ruptured or intact, amount and character of show or vaginal bleeding, vital signs, rate, location of fetal heart tones, plan to bottle or breastfeed, any problems with this pregnancy. Evaluate the patient's current emotional status, evaluate the patient's preparation for labor through classes, evaluate for possible danger signs. Perineal preparation, cleansing enema, evaluation of uterine contractions continue throughout the first stage, monitoring and recording color and amount of shock, fetal monitoring, bladder care, vaginal examination, prevention of infection, NVO, only clear fluids are advised, positioning during the first stage, emotional support, partograph, pain management and drugs also should be monitored. The nursing diagnosis include deficient knowledge related to the lack of exposure, risk of fluid volume may be related to decreased intake, increased loss, risk for fetal injury related to the hypercapnia, infection or tissue hypoxia, risk for maternal infection related to the fecal contamination, invasive procedures, repeat vaginal examinations, rupture of amniotic fluid, risk for ineffective coping related to the inadequate support system or coping methods, personal vulnerability to situational crisis, risk for anxiety related to the interpersonal transmission situation crisis or unmet needs, acute pain related to the pressure on the adjacent structures, stimulation of both parasympathetic and sympathetic nerve endings or tissue dilatation and muscle hypoxia, impaired urinary elimination related to the altered intake, effects of which anesthesia, fluid shift, hormonal changes or mechanical compression of bladder, fatigue related to the changes in energy production, decreased caloric intake, risk for decreased cardiac output related to the changes in cardiovascular resistance, decreased venous return or hypovolemia. Cause of infertility: female infertility, severe endometriosis, pelvic inflammatory diseases, ovulation disorders, elevated prolactin, polycystic ovarian syndrome, early menopause, benign uterine fibroids, pelvic adhesions, congenital defects in genital tract, dyspareunia and vaginal causes, cervical factors and tubal factors. Male infertility causes include disorders of spermatogenesis like hormonal hypothalamic disorder, pituitary secretion of FSH and LH, hyperprolactinemia causing impotence, hypothyroidism, adrenal gland disorder, diabetes. Primary testicular disease include idiopathic varicocele, chromosomal defect, Klinefelter syndrome, cryptorchism, drugs, radiation. Orchitis, chronic illness, immunological disorders, duct obstruction like congenital abscess, inflammatory block and surgical trauma, accessory gland disorders like prostatitis, vesiculitis, congenital absence of vas and cystic fibrosis, disorders of sperm and vesicular fluid, sexual dysfunction, psychological and environmental factors. Minor disorders of newborn include vomiting, failure to pass meconium and urine, constipation, diarrhea, physiological jaundice, hiccups and sneezing, excessive crying, oral thrush, excessive sleep, mastitis neonatorum, vaginal bleeding, Catbit succedaneum, calcified hematoma, asymmetric head shape, craniotab, sore buttocks, and napkin rash, erythema toxicum, harlequin color changes, subconjunctival hemorrhage, subcutaneous fat necrosis, tongue tie, actinectorium, congenital hydrocele, congenital teeth and bored legs. Vesicular mold. We have to write about the definition, etiology, risk factors, clinical features, treatment measures like surgical, nursing, and prophylaxis, complications of vesicular mold. Puerperal sepsis. It's also been referred in the previous question paper. Role of nursing administration of oxytocin mainly include assessment, intake output ratio, Uterine contractions and fetal heart rate, blood pressure, pulse and respiration. Administered by IV infusion, monitor the drop rate, make crash cart available, evaluate length and duration of contraction, notify physician of the contractions lasting over 1 minute or absence of contraction, teach the patient to report any increased blood loss, abdominal cramps or increased temperature. Give reasons. Fundal height measurement is important during pregnancy. Fundal height is one of the indicators of fetal well-being, especially in the late pregnancy. The fundal height is static or not increasing. It may indicate a UGR or placental insufficiency or oligohydramnios. At the same time, if the elevation of fundal height more than the normal, it may indicate polyhydramnios or multiple pregnancy. Amenorrhea and anovulation can occur in lactating mother. During lactation, there will be increased prolactin level that leads to inhibition of ovarian response to FSH, less follicular growth, hypoestrogenic state, no menstruation. Same time, increased prolactin levels lead to suppressive release of LH, no LH surge and ovulation. Lengthening of cord during third stage of labor. As the placenta separates and falls in the lower uterine segment, there will be a small fresh blood loss and enlarging the cord occurs. It indicates the placenta separated and falls in the lower uterine segment. Eclampsia is a severe form of preeclampsia. Preeclampsia with convulsion and coma, it is called as eclampsia. It can occur the sudden deterioration of the condition or with non-compliance to the treatment of preeclampsia. Intrauterine devices are not used in newly married women or when the pelvic pathology present because it may lead to IUCD expulsion or lead to pelvic inflammatory disease and infertility later. Differentiate between cytotrophoblast and syncytial trophoblast. Cytotrophoblast is the inner layer of trophoblast, otherwise known as the Langerhans layer. It is well defined in single layer of cells produce HCG. Syncytial trophoblast, outer layer of multinucleated syncytium, otherwise called plasmoid trophoblast. It erodes the blood vessels of deciduva. Osianderson and Goodell-Sein. Osianderson is an obsolete term that formally defining vaginal pulsation that mirrors the maternal heart rate as an early sign of pregnancy. Goodell-Sein is a significant softening of the vaginal portion of the cervix from the increased vascularization. This vascularization is a result of hypertrophy and engorgement of vessels below the growing uterus. Cytocele and Urethrocele. Cytocele is a herniation of bladder through the lax abdominal wall. It is due to laxity in descent of the upper two-thirds of the anterior vaginal wall. Cytocele contains bladder, which commonly forms the bag of residual urine. Cystitis and ascending infections of the urinary tract may follow. Urethrocele. Urethra herniates through the lower third of anterior vaginal wall due to laxity of facial tissue intervening between urethra and vagina. Triangular ligament anchoring of the urethra to symphysis is also be torn. Speculum and KUHS speculum. Speculum is a double-bladed posterior vaginal speculum based on the unequal breadth of the foster introduction into the vagina depending upon space available. Narrow blade is used in case of nulliparous and wider blade is used in case of parous woman. It is used in obstetrics to inspect the cervix and vagina following delivery, to clean the vagina following delivery, to inspect cervix and vagina, exclude any local cause of bleeding in APH and during D&D operation. KUHS speculum. It is a bivalve self-retaining vaginal speculum. It used to visualize the cervix and vagina fornix for any local cause of PPH, to inspect the cervix and prepare cervical smear for cytology screening, and to detect leakage of liquor from the cervical os in case of suspected PROA. This is the differentiation between abruptia placenta and placenta previa. Differentiator based on onset, bleeding, pain and uterine tenderness, fetal heart rate, presenting part and shock. Thank you for listening.